My name is Mike Marvel. I live in Clayton, North Carolina with my wife, Pam.
I am Pam Marvel. We moved to Clayton in 1982. Life was quiet. It was small town. I was normal for about 8 years. And then I got this brain problem. We went to all the doctors around here. Nobody had ever done surgery in that area of the brain. So we just kept trying and finally found a surgeon in Phoenix, Arizona. During the surgery, they had accidentally clipped a nerve, and I was partially paralyzed on the left side of my body and right side of my face. No physical therapy in the Clayton area. And then 2 years later, I was diagnosed with breast cancer. The major challenge of going out of town was leaving all the family and friends.
We had incredible help from family and people that helped us financially to do this. And I began to see, how awful it is if you have to do these things and you wouldn't have had a person that would give you a condo for a month and a half in Phoenix and a car to drive while your wife was in the hospital. And what would you do if you had to do that, and who was going to take care of your kids?
So many people coming into our community don't have an extended network of friends and families to care for them in their time of need. And that's where we want to be able to step in. We want to be part of that safety net, helping people in our community who otherwise might fall through the cracks. I think some people might be surprised to learn that 13% of the people under age 65 in Johnston County are actually uninsured. A lot of those are folks who are working but maybe can't afford the health care coverage offered by their employer. Contributions to the Johnston Health Foundation help to alleviate that financial burden of medical care and empower the uninsured population to embrace healthier lifestyles. Funding to the Johnston Health Foundation increases access to health care by funding things like our mobile outreach services, where a mobile unit actually goes out into the community and provides care access on the weekends and nights when those services aren't always available. We also are funding health screenings for vulnerable populations and holistic care for breast cancer patients, things that are not typically covered by insurance, like nutritional supplements, lymphedema sleeves, and transportation costs that, if otherwise weren't covered, might present barriers for someone to get healthy or stay healthy.
My wife and I have seen what it's like to be in an area that really didn't have health care close by, gone through a lot of the issues and things, and now we've seen an area that's grown and just fantastically, and we've got the best facilities here for everything that we need.
All the people in the Johnston County facilities have been very nice.
The Health Foundation is there to make sure that the folks in our communities that can't afford, or for whatever reason can't get to the health care they need, since it's close by, we're going to find a way to help them.